Hi there. I'm really happy to be here. I've attended so many of these webinars over the years, but I don't think I've ever been on this side of the table. So thanks for inviting us. And I think Victoria and Laura are happy to be here as well. So speaking to the broad public health research and practice audience, I know we're all familiar with the kinds of terms like health begins where we live, work, learn, and play, and just setting the stage that transportation is one of these social determinants of health. I know in my own work, I sometimes think about the direct links between transportation and health outcomes, whether it's like physical activity benefits or road safety concerns. But at the end of the day, the transport trip itself is not the only part that really matters. So the ultimate goal of transportation is actually really to get about on your daily activities and to participate in society. And so in those bigger ways, I think it's important that public health recognizes that it has a role and responsibility to play in shaping transportation opportunities. So today's conversation, and I'll be switching the slides for the whole team, is about a new report that we have out, Practices and Inspiration for Transportation Equity. And it was one that was really motivated by questions we kept hearing from municipal staff about how to move equity forward from rhetoric to reality. We sort of grounded this in the transportation space, but for everyone on the call, the lessons that we learn here are really broadly applicable to municipal contexts, whether you're into housing, whether you're into parks and recreation services. And so I think there's lessons to be learned. I'm going to introduce the report and sort of the motivation for the work. Victoria is going to come on and share a portion about how our work that was looking at how cities are formalizing equity into their policies. And then Laura's going to come on and share some examples from her team's work at Vancouver Coastal Health about opportunities and challenges they've had as public health practitioners trying to make action on equity. So I'm sure these experiences are going to resonate with you. We are going to use Menti a couple times as we go through the event, and we look forward to hearing from you. So as sort of the grounding basis, I want to highlight that research would show that over 1 million Canadians live in transportation poverty. And this is where their ability to access opportunities, as I spoke about, is limited by inadequate, unaffordable, or unsafe travel conditions. And the injustices that are baked into our transportation system have been built up over time from inequitable planning practices, and they're standing in the way of people's access to jobs, education, healthcare, and social opportunities, ultimately impacting both health and well-being. So that backdrop is also in the context that right now, and for some time, we've been seeing governments making major investments in active transportation and transit. And we've seen at the same time that municipalities are often trying to take up the work of equity and formally recognize it, and they're using policies and frameworks. So at this point in time, with that influx of investment, increased attention to equity, there's a real opportunity to make transportation systems that work for everyone. What we're hearing as we work with municipalities across the country and beyond is what's missing is how to action on these kinds of commitments on the ground. So in your day-to-day practice, how are we going to move this forward? Ultimately, the question being, how can we as cities move transportation equity from rhetoric to reality? So to tackle this, we set out to assemble really practical guidance and to take inspiration on how equity can be meaningfully embedded as people are planning for sustainable transportation. We've been doing a research process as a group for more than a year. It includes sort of crowdsourcing, policy reviews, extensive interviews, and dialogues with transportation and equity practitioners across the country to delve into what works in their cities, to delve into what's failed, and to ask them questions about why. So the work is summarized in a report that we've put out. It's available, and there should be links in the chat at this point in time. It's really the work of a large collaborative team. And in particular, I'd like to thank sort of core players on the Interact team who have supported it, as well as Victoria Barr and 2 students, Tessa Williams and Jamie Fisher, who have made invaluable contributions. I'd also like to say that we've engaged with many transportation and equity practitioners as we've done this, and their experience has shaped the product that we've put forward and the content of it as well. So the report has sort of 5 key areas, some of which we'll give you more content on today. One of them is about key elements that define transportation equity and resources for learning more, which I'll cover. Another is about considerations for the development of municipal, like citywide equity policies, and Victoria is going to take that up today. There's lessons learned from in-depth case studies about the transportation equity journey of some cities that are doing well in Canada. And then we sort of summarize 15 promising practices that came out of all of this work for how you can move forward embedding equity in sustainable transportation intervention, planning, and evaluation. The report has sort of a stage setting at the end that has remaining challenges and where the field is heading next, which is a rich discussion. So just to get us sort of started in an interactive way, some of you I'm sure have used Menti before, but if you go to menti.com and enter the number at the top, you should be able to activate. Yeah, it's working. So the question being, how often does transport equity come up in your work as a public health practitioner? Just take a few minutes. Thanks for your insights there. And we have a few things, so there's going to be some open-ended comments as well if you want to get logged in and set up for those after each of our sections. So a couple people with all the time front and center, but also people saying more and more or rarely and not at all. And I think that, you know, I hear that across the different cities I work with. So it's a really different context across different places, depending on leadership and sort of what activities are underway as well. So thanks for that. I'm going to move us on. One of the things, and especially for people who might say this rarely comes up in your work on that last Menti poll, is that we hear that there's confusion about what equity means and what equity means in transportation. We hear more generally that the term equity can be thrown around and co-opted so much that it loses meaning. And that's certainly true across different contexts and with people at different stages of their careers or different disciplines. So in response to what we heard, we included an explainer in the report around what transportation equity is and is not. Our practice partners said they needed this kind of document for when they're speaking to elected officials, when they're talking to the public, or when they're talking to different departments. Just as framing, transportation equity involves prioritizing facilities and services that favor structurally marginalized or under-resourced communities. It encompasses both like the fair distribution of transportation resources across communities, across space. It also includes inclusive participation in decision-making processes and a recognition of the prevailing injustices. So some big pieces there, and that it's multifaceted. The explainer has sort of 5 points, and I will just take a minute to speak to them here, because I think these are key messages, and some of them might be places where you've struggled in your own work. So the first one being that equity is not the same as equality. I think in public health circles, we know this very well, but it goes to say that other people often need a reminder of this, and there's context and resources in the report on that would be shareable to different audiences and have resonated there. A second thing is that equity is about people. So when we work in a transportation space, often people are preoccupied thinking about different modes, or they're thinking about moving vehicles. And actually putting people back into the picture is a great first start if we're going to start thinking about equity, and that needs to be a reminder sometimes. That equity is intersectional. So this term coined by Dr. Kimberly Crenshaw, feminist Black scholar, in the transportation space, just emphasizing that transportation injustices people face are a product of multiple intersecting facets of their social identity, be it race, language, gender, wealth, ability, and that an important component is naming the power structures that are at play. But this kind of terminology may not be clear to everyone you're interacting with. The fourth one being that equity is about process and outcomes. So equity is a process. In practice, might look like ground truthing your data with community members to fill in the gaps of what's not collected by conventional sources. Equity as an outcome could be setting goals to reduce the unfair differences that we see in the burden of pedestrian deaths and injuries. And the final one is that equity is linked to systems of power and driven by systems of power, be it issues like colonialism, white supremacy that underlie every injustice in our transportation systems. So these affect where interventions are made, who can afford to live in these spaces, and who's engaged, who benefits, and who might be displaced. So that's all in the explainer if you're needing content on this. At this point, I'm going to transition over to Victoria.
Okay. Oh, can you hear me? Oh, can you hear me okay?
Yeah.
Beautiful. There's two buttons I had to press. Thanks, Megan. Appreciate that. And thank you so much to NCCEH for inviting us today. I'm grateful to be joining you all today from the lands of the Lekwungen-speaking peoples, specifically the Esquimalt and Songhees nations, a city also known as Victoria, BC. So as Megan said, in terms of our project, the Peace Project, the first piece that we are looking at was how are cities formalizing equity commitments into policy. So after 2020, we saw municipalities accelerate the creation of citywide equity policies and frameworks to formalize their commitment to address harmful inequities in community planning. So we're trying to get a sense of, okay, what are communities, or what are municipalities, what are local governments and regional governments doing across Canada in terms of having that broad equity policy that would guide their work moving forward. For many cities, this is a first step. So we did a broad scan of citywide equity policies. Next slide, please. Municipalities hold unique capacity to advance or undermine equity. So with that in mind, in the first phase of our project, we searched for formalized equity-based policies within local or regional governments across Canada. We searched 36 municipal websites, and we found 22 communities with equity policies. It quickly became clear that there were a wide variety of approaches to equity policies or frameworks. It's important to note, though, that our scan and this research is just one snapshot in time. And since we've done this research, some of these cities, some of these communities have moved forward in their work in a variety of ways. And then there have been new communities or new cities that have also started this work. So there's actually, if we did this now, the list would be quite a bit longer. In the end, in terms of our scan, we narrowed our analysis to 8 cities and did an in-depth look at those. Those 8 cities are there: Vancouver, Ottawa, Halifax, Edmonton, New Westminster, Victoria, Saskatoon, and Montreal. We analyzed the contents of equity policies in each of these cities to compare and contrast their key elements, like how equity is defined and the processes, tools, or indicators included. From this, we identified 10 considerations for the development and implementation of municipal equity policies in Canada. Next slide, please. Thanks. So here are those 10 considerations. And again, you can read more in our report. And I think Zoe's put a link to the report in the chat. Thanks, Zoe, for your support. So here are the 10 considerations we came up with. And we welcome discussion and other ideas from people who are involved in this kind of work at the local level. We don't have time to talk about all 10 today, but I will highlight 5 of them and go through those 5 in a little bit more depth. And again, you can read more in the report. Okay, so the first one I will review in a little bit more depth is the consideration number 1, start with a clear vision for systemic change. So what we learned is that equity policies have a variety of starting points. Some policies focus on why equity needs to be integrated into municipal affairs, while others concentrate on how, and some policies or frameworks did both. These different approaches signal the need to take concrete action to treat the acute symptoms of inequities, while also working towards structural changes that address their root causes. We encourage local governments to be thoughtful as they formulate their vision, their ultimate goal. That can take time, and it can be a messy process, but it's vital. Next slide, please. Thank you. The next consideration I'd like to highlight is number 2, ground the approach in local context. This is something that public health, in particular like community-based health promotion, does really well. Most policies describe the local context at a high level, missing the opportunity to increase awareness of how local history influences inequity. However, Ottawa developed snapshots or data-driven profiles of priority populations to highlight relevant issues. And Edmonton did a really interesting thing. They compiled a resource of historical negative externalities resulting from zoning. This kind of context can recognize the lived experience of structurally marginalized people, demonstrate the impacts of structural inequities, and help staff to prioritize issues to help redress historical harms. Next, thanks. We also found that some policies use language that signals a stronger commitment to equity. Concepts such as anti-racism, white supremacy, or decolonization demonstrate a willingness to confront systems of power, whereas policies that stick to terms such as diversity, inclusion, or belonging suggest a reluctance to go there. Language really matters. The words we use matter. We need to be explicit when naming power systems that contribute to inequities. Next slide, please. The number 5 consideration is apply an intersectional approach. And Meghan already introduced that term to you earlier for those who aren't familiar. Most of the policies we analyzed define intersectionality as an essential concept, and that's a wonderful thing. To me, this says that local governments are trying to better understand the complex and nuanced experiences of residents through the lens of overlapping identities, such as gender, race, or class. GBA plus, gender-based analysis plus, and disaggregated data are common tools for actioning intersectionality, but there is room to expand. Local governments local governments know they need to understand diverse needs within their community before they can respond to them. But they are still developing methods to assess differences between and within groups. And finally, the last one I'm going to highlight is number 8, create structures for accountability. Some of the policies that we looked at include structures to oversee the implementation of equity initiatives, to take the next steps beyond just talking about a policy, but actually see some implementation and see that action on the ground. They're also there to, those structures are also there to hold the local government accountable for its commitments and to cultivate cross-department collaboration. Halifax opted for departmental level action plans monitored through annual reporting. New Westminster recommended the creation of a dedicated equity office with permanent funding, similar to those in Edmonton, Halifax, Vancouver, and Victoria. This is everyone's work. Equity work is everyone's work, but the coordination of that work should not be done off the side of someone's desk. We need to commit time, staff, and resources to equity. So there's the 10 considerations again, just to bring us back. We humbly offer these 10 considerations as a potential way to help municipalities along on their policy journeys. But as I said, we aim for these considerations to be initial points for discussion and collective learning, not the answer or a recipe to follow. We know that each place is a specific context and there are different levels of readiness. It's important that each local and regional government gear this work to their own context, guided by community members. So that's a quick snapshot of that part of the project in terms of the scan of policies from the local government or regional government perspective. So we have another question that for you to answer and get another part of your brain working. The question is, what are local or regional governments not paying enough attention to when it comes to equity policy? What are they missing? So we welcome your answers to that. Feel free to provide multiple responses if more than one idea pops into your head. Okay, I'll give a minute for folks to answer that question. Making hard choices. I like that one. Okay. Beautiful. Yes, so it's interesting that there's a wide variety of aspects that we could be doing better at, or that we could be filling those gaps. Interesting. Can you scroll up again? Is it possible to just to see some of the earlier ones? Yeah, thanks. Making hard choices, I really like that. This work is not meant to be easy. And bringing Indigenous voices to the table as a distinct nation. Thank you. I like that one too. Is there any way you'd like to highlight, Meghan?
No, you know, as I read these, I think it is a nice segue into the next section, which gets to a little bit more about some granularity, because that's ultimately what we were asked for it. And when we look at what cities might be missing, you know, sometimes you're like, oh, but there's this detail, there's population, or this step that I feel like is missing. So that was a question we heard all the time. The question wasn't like, should we move forward tackling equity? But it was more like, how do we do this? And how do we do this in our day-to-day jobs? So the groups, and especially transportation planners we were talking to, were wondering how they should take these frameworks that Victoria introduced and like do their work differently at the job. So through the course of the case studies and workshops that we did with transportation planners and equity practitioners, we ended up with 15, the report presents 15 promising practices for how you can really embed equity into sustainable transportation interventions. What I would highlight is that these span a range of different activities. So if you're at the stage of thinking about policy and strategy, there's steps you can take. If your role is in engagement, which is a place this often comes up, there's steps you can take, but there's also steps and inspirations, whether you're at prioritization or whether you're doing evaluation. So across the board, there's steps that cities can take, and they're color-coded here. Where did we get these from? The report, we did an in-depth case studies on 3 cities that seemed to be making moves around transportation equity, that were doing well on this. And these cities are New Westminster, Edmonton, and Ottawa, where we did interviews with practitioners there to really get their take and describe their stories. The promising practices and case studies really give you the richness about some learnings and successes from the view of the cities. And I'll highlight Ottawa's today as I'm speaking a little bit. In addition to those deep dives, we also recognize those contexts aren't reflective of some of the other places, and there are snapshots that come from the County of Kings in Nova Scotia as a smaller community that's taking steps forward, some from Toronto where there's a whole range of activities underway, and then some from the US context, which has some policy differences, but also is moving forward in some cities well on this front. So I just want to highlight Ottawa. Ottawa was one of Canada's first cities to create an equity policy, sort of back to 2010. And there's 4 really promising practices that I want to speak to that came out in our conversations with Ottawa. The first one was a step they took around really example of mainstreaming equity in policy. So what you see on this visual is the policy context that we heard about from practitioners in Ottawa, that they built a strong policy foundation. They'd enshrined equity into their official plan and into their transportation master plan. And because these policies translated equity concepts into specific directions for land use and for transportation, it was clear by centering equity in the core plans that this could guide the work of the practitioners. And this could guide the work of technical staff. They could see the equity mandate that was explicit to their discipline. A contrast case is that sometimes people feel equity work belongs to social planning. And in this case, it was clear through the land use and transportation plans that equity was the work of those departments as well. A second example, we heard Ottawa take steps to map inequities to guide investment. So equity is a complex topic. It can be difficult to conceptualize at the community level. And Ottawa made this tangible by mapping out priority neighborhoods. These are areas where residents were more likely to experience mobility barriers. And the map is an existing sociospatial data set that they use in their official plan. It identifies neighborhoods that are economically and socially vulnerable. And so that meant they could use this layer to do analyses in their transportation master plan to direct engagement and investment to these equity priority neighborhoods. So they've put it to use. A third point where Ottawa stands out is considering and naming equity implications when preparing corporate reports. So these kinds of reports are one of the key sources of information used by decision makers, but these corporate reports don't always include sections about equity impacts of recommendations. Ottawa decided to take a more systemic approach to this. They added a section to their corporate report template. It's called Gender, Race, Indigenous, and Equity Implications. They note that the section's optional, but the optics of not filling in this section can be problematic. And so really staff are motivated to think through and consider the possible equity implications of their work. And this reporting mechanism enables councillors, residents, and media to also look at the equity impacts of city decisions, which helps around accountability and transparency of equity work, which are important concepts. The fourth one from Ottawa is a structural one that they've done within their teams, and that was to embed equity specialists in transportation projects. So we know that people from structurally marginalized communities tend to be underrepresented in transportation practice. And we know that they also don't participate in traditional public engagement necessarily. So Ottawa took steps to address this by embedding equity specialists in the development of their master plan. These are staff teams. The specialists are part of these larger staff teams that are responsible for advocating for the needs of structurally marginalized groups. And what we heard from the people we interviewed is that these specialists, when they were embedded, tend to question the status quo, and they would provide really valuable insights based on their equity training, their lived experience, or their relationships with the community in order to actually shape different outcomes than what would have happened without those specialists on board. So those are a snapshot into Ottawa. There's also detail on Edmonton and New West, which highlights different kinds of practices that people might be interested in. And so you can go to the report for those. At this point, Laura is going to come on and share some of the experiences from public health practice. Thank you, Laura.
Thanks, Megan. And I just wanted to acknowledge the fact that I'm coming and presenting to you all today from the traditional and unceded territories of the Squamish, Musqueam, and Tsleil-Waututh people. And I think that the question on the slide right now, what opportunities can public health practitioners seize to action on equity, is something that we've really contended with for anybody who's kind of worked in healthy built environment or healthy public policy over the last decade or so. When I started out, it really seemed like we were trying to just illustrate that certain populations didn't have the same access to opportunity, but it's now becoming sort of common language and common practice, and we're really getting to a point where we can start elevating this and putting it into practice. So I'll go through a couple of examples where we've had different levels of participation from VCH to incorporate equity into our work, and this will include actions where we've run, where we've filled some identified gaps ourselves and used that to inform policy, where we've guided, where we've had more passive participation, either by writing a letter or presenting to decision makers and advocating for additional strategies or actions, or providing feedback in an exchange with local government staff, or where we've ridden along, where we've participated as an active partner on a project with local government and staff and others. Next slide, please. So I believe that we're probably all quite familiar with the tragic heat dome that BC experienced in 2021 that resulted in the documented deaths of 619 people due to extreme heat. From the BC Coroner Service, we know that 98% of these deaths occurred indoors in a residence. 56% of those who died lived alone. 67% of these individuals were over the age of 70, and 60% of these individuals had seen a medical professional within 1 month prior to their death. And most of these, or more of the decedents, lived in socially or materially deprived neighborhoods. Next slide. But what I would like to highlight is VCH didn't wait for this information to take action. I think what we had a unique opportunity to do was we recognized early on as a health authority that climate change adaptation was going to be something that we need to contend with. And this really allowed us to run with equity-focused actions that the health authority can take responsibility for and ownership of. In 2018, we started a project with UBC and Fraser Health to complete a climate change and vulnerability map. This highlighted exposures and sensitivities and adaptive capacities of neighborhoods in our region to adapt to extreme heat and other climate hazards. This included recognized pre-existing conditions, individuals' health, neighborhood, community preparedness that would contribute to increased risk of poor health outcomes related to exposure to extreme heat. Knowing this, we knew that the 2021 heat dome would have disproportionate impacts on our communities. The event, though very unfortunate, did allow us to catalyze work on heat adaptation. And this started with the preparation of a heat check-in framework for non-governmental organizations that work with populations that we know who are at higher risk, such as seniors. And through our own engagements with folks with lived experience, reporting to calls to action from the lived experience of extreme heat in BC report and the coroner's report, we do know that in absence of having access to mechanical cooling in all residences, transportation access to community cooling centers is still a gap that needs to be filled. And we're really trying to figure out how we can advance that conversation with the right people, because multiple people are going to be needed to solve that problem. Next slide. Historically, a lot of the work that we've also done in this space has revolved around reviewing plans and strategies and providing feedback or guiding our partners to include a health and equity lens in their work. For those of us who've been working in the realm of healthy built environment, it's really probably where the majority of our engagement has started, and it hasn't always been clear to us whether or not our comments have been well received or if they were even useful. For us, it's taken a variety of different shapes, from writing in support of the City of Vancouver's Climate Emergency Action Plan and their parking program to having more focused conversations, but having our involvement focused still quite largely on reviewing drafts of strategies such as the Metro Vancouver region's regional transportation strategy. It is important to note, though, that sometimes this method of engagement does open up doors for us to have more focused conversations with staff. And this helps to build and strengthen the relationships that we have with them, to have more conversations about the challenges that we all face to embed equity into the work. Other times, we're just dependent on council results, and we can then figure out where the priorities lie. Next slide. We've also had opportunities where we've been able to ride alongside our partners to embed a health and equity approach into the work. For example, we've had many conversations with the City of Vancouver and BC Housing on their joint Skeena Terrace development. Here, we've been able to highlight the fact that this site is in close proximity to two major highways, meaning that folks who live in this subsidized housing neighborhood are going to have higher exposure to traffic-related air pollution. We've also been able to highlight the challenges of access to affordable food options for individuals here, as the closest grocery store, while walkable and affordable, does require crossing a 6-lane highway and travel up hills both ways. And that's given us the opportunity to then investigate whether or not there is a possibility of having an affordable food provider on site, and whether or not that's even a possibility. We've also had the opportunity, next slide, to participate in Metro Vancouver's social equity mapping project. And here we had the opportunity to be an active participant, and we were able to bring forward some existing data sets that we had access to enhance the project. So in particular, we really looked at trying to enhance the knowledge around children's active transportation and improve those data set accesses. And this really helped the project team to understand what other types of data were available to help understand the needs of children and youth in transportation, as well as revealed some of the challenges in accessing that data and utilizing it, which, as Victoria alluded to earlier, this is also a great learning opportunity for everyone, because we don't know everything. And I didn't know that the data was going to cost $600 to access, for example. And then finally, we've also had an opportunity, next slide again, to work with Translate's Travel Smart team as they develop their Travel Smart for Kids strategy. Our conversations really helped to frame and structure the plan to highlight the needs of children and youth to better enable independent mobility. We aim to reduce the emphasis on needing to travel to school, which is needed, don't get me wrong, but we wanted to highlight the need to access other amenities and spaces where kids want to travel to. For example, parks, malls, movie theaters, wherever kids want to hang out, right? These opportunities emphasize that this work relies strongly on relationships, building foundations in relationship building, and really having good communication with others. These relationships allow us to have off-the-record conversations, and those are sometimes what's needed in order to move the needle forward. It's allowed us to have opportunities to speak more directly with our partners on areas of intervention where we might not have otherwise felt comfortable. And sometimes it's hard because we don't necessarily feel like we're adding something significant, but I think what's really important for us to remember is that without our voice, some of the equity concerns wouldn't be heard. And the foundation of our work is not just to provide the evidence-based linkages between health and the built environment, although that is a very important role for us, but it's also to take stock of who's not being represented in the room, who needs to be heard and who isn't being heard. And I think that that's a really important role that we as a health authority or health practitioners can bring to these processes. Next slide. I think I have a Menti. So the question back to the audience is to think of a transportation project where you were involved where we had successful incorporation or embeddment of equity, and what components of that worked well. I think.
Fair enough. If you haven't worked on a transportation project, feel free to broaden that. I feel like Laura had wonderful examples from housing in that Skeena project as well.
Community champions, yes. Shared use paths. Integrating housing with access to transportation. Identifying those who are most vulnerable, children, youth, older adults. Public health established a nonpartisan active transportation advocacy group with a mission. Utilizing photo and voice photo and video voice. Yes. I think another thing that's worked really well for us is having some local data and evidence that we can pull from. Something that we reference to a lot, though is now very old data, is the 2013 My Health, My Community project, where we had a lot of really localized data. And I think that that really helped get new evidence onto the table, and we were able to share that with our partners. And I think that's always been helpful. Yes, updated and disaggregated data.
And I like the How I Get to School drawing activities for kids. I do university students too sometimes. So lots of face challenges. A showcase. Well, yeah.
Yes, checking in with a consultant offline. Yeah, I really do think that having some of those one-to-one relationships and trying to have some of those conversations can make a really big difference, and even just enhancing people's understanding of where the ideal state might be. And there are always going to be competing priorities, but I think that that's always been quite important, and I think that that's been where we've been most successful.
You know, something I often hear as I work sort of on the other side of the municipal side is some people don't know who their public health contact is. Or so that, like, whether it's because it's not always present on the website who to contact. And I think it's great when people are able to stay in their positions for longer times with less turnover, or their roles even, so that you can develop those kinds of relationships. But some levels of transportation staff don't necessarily know sort of who those are. And I'm pleased we're back in person for many events, so that there's more of an opportunity to do that networking and have those informal relationships. Okay, so thanks Laura so much. I feel like those were excellent examples, and a lot of the sort of promising practices from our report resonate with the pieces that you have there as well. Just as a close, I want to say to our presentation part, I want to say that, like, no one we spoke to in all of our work felt like they had all the answers. What was really clear is that equity work isn't done alone. It's not done just by a municipality or just by one department. Progress was possible because of the collective efforts across many departments, sectors, and disciplines. So each person has a role. Decision makers and elected officials have a role, but it takes the work of many people, and that was the narrative within our case studies, which were places who were moving well. So I think from this, it's really clear that public health has a role to play, and I hope that the report and this presentation has given some inspiration on how you can move this forward in your own projects. I invite you to take a deeper look at the report, to share it with people in your organization or beyond your organization who you think would benefit from it, whether it's the explainer or whether it's some of the tools and descriptions within it. We're having a number of conversations across the country and in different formats, so I think watch for that. And if you're interested in hosting a workshop within your organization, and part of my research world and the people on the table are always here to sort of help groups move forward. I often talk about you got to meet a group where they're at and help them with strategies that make sense to them to move forward, which ultimately they need to shape and inform very much. But happy to help with those conversations or ideas for them as needed. This is a contact information for Interact if you'd like to sort of join the conversation and follow along. And a great thanks to Zoe Poirier-Stevens and Meredith Stones who helped with this content here today. And thanks for participating on the Menti. I think that it's nice to be able to have the voices come out now. So I think we're ready, Tina, to go over to Q&A.